Elizabeth Warren was asked about Medicare for All on TYT, and I don't love her answer here. I'll let you watch and decide for yourself, and then I'll break it down a little bit.
When you say Medicare for All, do you mean, for example, the bill that you've co-signed onto in the Senate, or do you think it could also mean Medicare buy-in, et cetera?
So I support Medicare for All. I have for a very long time. And I believe that there are lots of ways to get there. So for example, even in the bill that I've co-sponsored with Bernie and others, it's got a 4-year period in it. It's got different ways that ramp in. It's got some groups that never get into it. For example, veterans will always have a separate healthcare system. There are a lot of different ways that people talk about it and have introduced into Congress. Some are actual bills, some have just talked about it. We could start lowering the age. So you could do it, rather than just saying how it is we're gonna build the ramp, you could build the ramp by saying 60 years old is the age for Medicare, 55, 50, or you could do it the other way. Everybody under 30 is covered, then everybody under 35, then everybody under 40. Different ways to move into the system. But there is one thing I would really like to underline here. First is the principle, and that is where we're aiming as Democrats, and that is that every single human being in this country is covered by healthcare at a price they can afford, that healthcare is a basic human right, and we are fighting for basic human rights. And I would like to contrast that with the Republican Party that's not having this conversation about the best ways to get there, but instead is still out there actively working to try to take away healthcare from tens of millions of Americans. So there are a lot of times I'm proud to be a Democrat, but when we're talking about healthcare, this is one of the biggest distinctions in something that would directly touch the lives of pretty much everybody in this country. And I like where the Democrats are on this.
So let's talk about the Democrats and the range of possibilities. So Sherrod Brown came out yesterday and said he is not for Medicare for All right now. He's for one of the options that you mentioned, which is people who above the age of 55 can buy into Medicare, okay? And other senators, have proposed just a buy-in and basically a public option.
Right.
Senator Sanders came on the show and said, those are all fine, but they're not Medicare for All. And so he thinks that the right way to go is to go for the Medicare for All package right now. So in that spectrum, where do you put yourself, and what do you, out of all those different options, which one do you prioritize?
Remember, though, even Senator Sanders' option, the option on the table, it's not right now. It's a 4-year option, and it's got layers as it goes into it. So everybody's talking about timing and how to get into it. And by the way, I just want to do one more piece as long as we're talking about this. I've put a bill that Senator Sanders co-sponsored out on the table that says if you want to offer private insurance, it's got to at least have the same kind of coverage and benefits that Medicare has. The advantage to doing this is we keep drawing these closer and closer together. So whether we're talking about coming from the bottom up, everybody under 30 is covered by Medicare, and then a year from now, everybody under 40, and then a year from now, everybody under 50, if that's the way that we want to angle in. But at the end of the day, I know what the center is. And the center is that we have high quality access for every single person.
All right, here's why I didn't love that answer. Well, first of all, at the end there, you heard her say high quality access to affordable care. I've warned you guys before in previous segments about what I call the Weasel Words. And Weasel Words are, you're a Democrat and you try to make the voter think you are telling them that you agree with them, but in reality you're not. So in other words, voters want single payer Medicare for all, everybody covered. 70% of the country wants it. Over 80% of Democrats want it. So you have politicians, instead of saying, I want single payer Medicare for all, they throw a lot of weasel words at you to give themselves wiggle room so that if they don't do it, they could say, I never said exactly that. They say, I wanted universal access to affordable care. Why are you saying access and why are you saying affordable? Because if you're saying affordable, what that means is I don't want free at the point of service. I want affordable at the point of service. That's not the same thing. Expanding access. I want you to be able to see a doctor. People could already see a doctor. It's just a matter of will they go bankrupt when they go to the doctor. Expanding access is not enough. It's not just about access to care. It's about free at the point of service, universal health care, single-payer Medicare for all. So she throws in some weasel words there, but honestly, that's not even the heart of my disagreement, because I think Elizabeth Warren might actually be naive enough where she doesn't realize the weasel words are weasel words. Like, she might hear them and think like, oh no, that's a Democrat keeping it real saying they want to expand coverage. My main problem with what she's saying here is she acts as if everybody involved in this conversation about healthcare, her Democratic colleagues, even the industry, even like the insurance industry, she acts as if they're all honest actors trying to get to the same conclusion. Like, and she said it. She goes, well, where we're aiming as Democrats versus where Republicans are aiming is very different. And what the Democrats are doing is we know where the center is, and we're all trying to work towards that point. So some people say, oh, let's expand Medicare to 60 and over. Let's expand it to 55 and over. And there's some people who want public option. But we all know that the center is we want to get everybody health care. And I even proposed a bill where I said private insurance companies have to offer at least the same benefits that people would get in Medicare. So in other words, her philosophy, her perspective is not we have an entrenched and powerful industry and lobby that will fight tooth and nail against the will of the American people and the best outcome. Her philosophy is everybody involved in this debate is an honest actor who we need to bring together because we all agree on the core of it, which is let's get everybody health care. And that is a fundamental incorrect view on her point, from her perspective. That's just incorrect. The for-profit health insurance companies, the big pharma companies, they're not allies who you work with to get to a good endpoint. They are entrenched, powerful lobbies actively working against the will of the American people. The for-profit health insurance companies literally have death panels, and you need to fight them. You need to fight them. Not, oh, we're going to find a way to work this out, and me and my Democratic colleagues, we know where the center is, the Republicans don't. So her argument seems to be like, oh, the Democrats, I'm on Team Democrat here, and the Republicans are on the wrong side. But Team Democrat, they're not all on the same side. So when somebody proposes a bill like let's expand Medicare to 55 and over, or let's do a public option, those bills at their core are protecting the for-profit health insurance companies. Those bills at their core are more interested in preserving the status quo than they are actually fixing our healthcare system and our health insurance system and giving people what they deserve. But she actually comes to it from this very naive perspective of like, oh, well, Democrats, we all agree ultimately. And so that's why some want public option, some want Medicare 55, some want Medicare for all. But the response to that is no, Liz, those are not the same thing. They're not remotely close to the same thing. The only people who are really fighting for the American people are the ones who say Medicare for all, full stop. And what she's doing is she's too naive and like, oh, we'll work it out and we'll start with this and we'll move to that. And no, you have to view the industry as your enemy. You have to view the elected Republicans as your enemy. You have to view even the Democrats who are not in favor of Medicare for all as the enemy, because they're ultimately trying to protect entrenched power and they're trying to protect the status quo. And Bernie gets that, and Elizabeth Warren does not get it. And it's that's a real difference, man. That's a real difference between Bernie Sanders and Elizabeth Warren. Now, don't get me wrong. I think there are issues where Elizabeth Warren is really spot on. Like, for example, for whatever reason, her pet issue is Wall Street. And she doesn't fuck around on that front, and she seems to get that, like, no, these people are not honest actors, and they're like rigging the system against regular people and for themselves. And so she has fought with that as her core belief. And so she's been very effective on that front. But for whatever reason, when it comes to healthcare, she doesn't see it that way. She doesn't see it the same way she views Wall Street. And that's devastating. And that really, really, it shows why you have like Bernie's number one, and then you have like, you know, Elizabeth Warren in terms of the Senate is like a distant but solid number 2 option in terms of the best senators in the country. But there's a real difference there. And it's I don't know if it's just naive or if it's politically calculated. I tend to think it's more just naive more than anything else. And she still doesn't get that the weasel words are real. She still doesn't get that this is an actual fight against powerful interests when it comes to healthcare in the same way it is with Wall Street. And I actually think that Cenk did a great job there, almost inadvertently exposing her shortcomings on that front. And take it for what it's worth, man. I mean, this is an issue where I don't even think it's close. I think Bernie is spot on, and Elizabeth Warren is barely in the same ballpark because of how her whole kumbaya, let's bring it together, we're all fighting for the same thing. No, you're not, and you need to fight, not, unite on something like this, because the people you want to unite with are actually the gaslighters who are trying to protect the status quo.